In the realm of men's health, the prostate remains a mystery for many. What if daily habits could unlock secrets about its well-being? Imagine a connection between a common activity and the health markers that define prostate wellness. Strange changes are happening, and they could reshape perceptions of masculinity and health. Prostate markers tell a story, one that reveals the state of this vital gland. But how does daily masturbation fit into this narrative? It's not just about pleasure, it could be a key player in improving these markers. What if this simple act is more than just a routine? As we dive deeper, we'll explore the surprising ways daily habits influence prostate health. Are you aware of the impact of regular self-exploration on your body? This isn't merely about numbers, it's about understanding your health better. And what about monitoring these changes? Regular checkups could illuminate the path to enhanced well-being. Stay tuned as we uncover the fascinating relationship between daily practices and prostate health, keeping the intrigue alive and the conversation going. Let's unravel the science behind what you thought you knew about your body. Definition and importance of prostate health markers. Prostate health markers are specific indicators that help assess the condition of the prostate gland. They play a crucial role in determining a man's overall health, particularly as he ages. These markers can include various tests and indicators, such as prostate-specific antigen, PSA, levels, which provide valuable insights into potential health issues. Understanding these markers is essential for early detection and prevention of prostate-related diseases. Regular monitoring of prostate health markers is vital for men, especially those over 50. By keeping an eye on these indicators, doctors can identify any changes that may suggest an underlying problem. This proactive approach allows for timely intervention, which can significantly improve outcomes. Men should not overlook the importance of these markers, as they can help maintain their overall well-being. Moreover, discussing prostate health with a healthcare provider can lead to better awareness and education. Many men are hesitant to bring up such topics, but doing so can empower them to take charge of their health. By understanding what these markers mean, men can make informed decisions about their lifestyle and health choices. In summary, prostate health markers are essential tools in evaluating and maintaining prostate health. They help in the early detection of potential issues, enabling men to seek appropriate care. Awareness and understanding of these markers can lead to better health outcomes and a more proactive approach to men's health. Effects of daily masturbation on prostate health. Daily masturbation can have a positive influence on prostate health, according to various studies. Engaging in this practice regularly may help reduce the risk of developing prostate problems later in life. This is thought to be linked to the way ejaculation helps clear out potentially harmful substances from the prostate gland. Moreover, regular ejaculation can promote better circulation in the prostate area, contributing to overall health. Improved blood flow can help keep the gland functioning properly, which is crucial for maintaining a healthy prostate. Some research suggests that men who ejaculate more frequently may experience lower rates of prostate cancer. It's essential to note that moderation is key. While daily masturbation may have benefits, excessive or compulsive behavior can lead to other issues. As with any aspect of health, balance is important. Most health professionals agree that a healthy sexual outlet is beneficial, but it should not interfere with daily life or responsibilities. In conclusion, engaging in daily masturbation may positively impact prostate health. While more research is needed to fully understand the mechanisms behind this relationship, the existing evidence suggests that regular ejaculation can be a healthy practice for many men. It's always a good idea to consult with a healthcare provider for personalized advice. Studies and related research. Numerous studies have explored the connection between masturbation and prostate health, yielding interesting insights. One significant study published in the Journal of the American Medical Association found that men who ejaculated more frequently in their 20s and 30s had a lower risk of developing prostate cancer later in life. This research highlights the potential protective effects of regular ejaculation. In addition to cancer risk, other studies have examined how masturbation may influence benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. Some research suggests that regular ejaculation could help mitigate symptoms associated with BPH, leading to improved quality of life for affected men. Furthermore, researchers are also investigating the biochemical changes that occur during ejaculation. The release of certain hormones and enzymes may play a role in maintaining prostate health. These findings further emphasize the need for ongoing research to understand the full scope of how sexual activity impacts the prostate. While the existing body of research is promising, it is important to approach these findings with caution. Correlation does not imply causation, and more extensive studies are needed to establish definitive links. Nevertheless, the current evidence encourages men to consider the potential benefits of regular ejaculation as part of their overall health strategy. In summary, the relationship between masturbation and prostate health is an evolving area of study. While findings are encouraging, ongoing research will help clarify these connections and provide more comprehensive guidelines for men regarding their prostate health and sexual practices. Potential benefits for overall health. Masturbation is often viewed through a narrow lens, but it carries potential benefits that extend beyond just the health of the prostate. Engaging in regular masturbation can lead to improved mood and reduced stress levels. When a person masturbates, the body releases endorphins, which are natural feel-good hormones. This can help combat anxiety and depression, contributing to overall mental well-being. Additionally, masturbation can improve sleep quality. The release of hormones during orgasm, including oxytocin and prolactin, can promote relaxation and make it easier to fall asleep. Getting quality sleep is essential for maintaining good health, as it supports immune function and overall energy levels, allowing men to feel more vibrant and active in their daily lives. Moreover, regular ejaculation may help reduce the risk of certain diseases, including prostate cancer. While studies are still ongoing, some research suggests a correlation between frequent ejaculation and lower prostate cancer risk. This could be due to the flushing out of potentially harmful substances from the prostate gland, contributing to better health outcomes. Masturbation can also enhance sexual performance. By understanding one's own body and preferences better, men can improve their sexual experiences with partners. This increased confidence and knowledge can lead to healthier intimate relationships, which is another significant aspect of overall health. Lastly, regular masturbation can serve as a safe sexual outlet. It allows for sexual expression without the risks associated with sexual intercourse, such as sexually transmitted infections, STIs. This makes it a healthy choice for those seeking to satisfy their sexual urges while minimizing health risks. Strategies for monitoring prostate health. Monitoring prostate health is crucial for early detection of potential issues. One of the most common methods is the prostate-specific antigen, PSA, test. This blood test measures the level of PSA, a protein produced by the prostate gland. Elevated levels can indicate inflammation, enlargement, or even prostate cancer. Regular PSA testing can help men stay informed about their prostate health status. In addition to PSA testing, digital rectal exams, DRE, are also recommended. During this examination, a healthcare provider checks the prostate for any abnormalities. While it may seem uncomfortable, a DRE is a quick procedure that can provide valuable information about prostate health. Men should discuss with their doctors how often these exams should be conducted based on their risk factors. Ultrasound plays a role in monitoring prostate health as well. Transrectal ultrasound can provide images of the prostate, helping identify any irregularities. This imaging technique is often used in conjunction with other tests to create a comprehensive view of a man's prostate health. Men should also be aware of their family history regarding prostate issues. If there's a history of prostate cancer or other related conditions in the family, it might warrant more frequent monitoring. Communication with healthcare providers about family history can guide personalized health strategies. Lastly, lifestyle changes can also be a form of monitoring. Maintaining a healthy diet, exercising regularly, and avoiding smoking can all positively influence prostate health. These proactive steps are vital for overall well-being and can complement medical monitoring efforts effectively. Myths and realities about masturbation and prostate health. When it comes to masturbation and prostate health, there are many myths floating around. One common belief is that masturbation can lead to prostate problems or even cancer. However, scientific research does not support this notion. In fact, several studies suggest that regular ejaculation, whether through masturbation or sexual activity, may help reduce the risk of prostate issues. This myth often stems from a misunderstanding of how the prostate functions and what influences its health. Another myth is that men who masturbate frequently may experience a decrease in sexual performance or libido. Contrary to this belief, many experts argue that masturbation can actually enhance sexual function. It allows men to explore their bodies, learn what feels good, and improve their sexual health overall. In reality, those who engage in regular masturbation may find themselves more in tune with their sexual desires, leading to greater satisfaction in intimate relationships. There's also a misconception that masturbation can cause infertility. This idea can be particularly concerning for men who are trying to conceive. However, studies have shown that regular ejaculation does not negatively impact sperm quality or fertility. In fact, some research indicates that frequent ejaculation may help improve sperm health by reducing the number of older sperm cells, which could be more likely to carry genetic abnormalities. Understanding these myths is crucial for promoting a healthy attitude toward masturbation and prostate health. Education is key. When men are informed about the actual benefits and risks, they can make better choices regarding their sexual health. Debunking these myths helps to reduce stigma and encourages open conversations about prostate health and sexual well-being. Ultimately, science continues to evolve, and ongoing research will provide more insights into the relationship between masturbation and prostate health. For now, it's clear that many of the fears surrounding masturbation are unfounded, and embracing a healthy sexual lifestyle can be beneficial for prostate health. Recommendations from experts. Urologists and health professionals often emphasize the importance of understanding one's body and its functions. They recommend that men pay attention to their sexual health and consider regular masturbation as a part of self-care. Not only can it help with stress relief, but it also promotes better prostate health. Experts advocate for open discussions about these topics, as they can lead to a greater understanding of men's health issues. Many specialists suggest that regular checkups with a healthcare provider are essential for monitoring prostate health. They recommend that men, especially those over 40, should have annual screenings, including a PSA test. This test can provide valuable insights into prostate health, and discussing any concerns with a doctor is crucial. Urologists often encourage men to maintain a dialogue about their sexual health, including the role of masturbation. In addition to regular checkups, experts advise men to adopt a healthy lifestyle that includes a balanced diet and regular exercise. These factors play a significant role in overall health, including prostate health. Maintaining a healthy weight and staying active can help mitigate various health risks, including those related to the prostate. Moreover, many specialists encourage men to educate themselves about their bodies and the importance of sexual health. This knowledge can empower them to make informed decisions regarding their lifestyles and habits. Understanding how practices like masturbation can positively affect health can lead to better outcomes. Ultimately, the recommendations from experts emphasize a holistic approach to prostate health. By combining regular medical care with a healthy lifestyle and open conversations about sexual health, men can take proactive steps toward ensuring their well-being. As we wrap up this exploration of prostate health and daily masturbation, it's vital to remember that understanding your body is key to a healthier life. The markers we discussed are not just numbers, they represent your overall well-being and can guide you in making informed choices. Have you ever considered how your habits might be impacting your health? Daily masturbation, as we've seen, can have surprising benefits for prostate health. But what about the myths surrounding it? Are they holding you back from making positive changes? Remember, regular checkups and open conversations with your healthcare provider are essential. They can help you monitor those vital health markers and ensure everything is on track. So, what steps will you take to prioritize your prostate health? Will you incorporate daily habits that promote well-being, or will you dig deeper into the myths and facts surrounding sexual health? Stay curious, keep questioning, and don't hesitate to share your thoughts in the comments below. Your experiences could help others in our community. Let's keep the conversation going and empower each other towards better health. Tune in next time for more insights into sexual health that can make a real difference in your life.